There are a couple of things that individual physicians can do. Change starts in ourselves and inside ourselves, and what we can also do in the area that where we live to lead to change. So, one thing that patients classify as extremely important is the communication with both physicians and nurses and all the health professionals. And one thing that we see in this report and we see in our daily life is that we are not provided with professional training on communication. The universities don't provide that. Even the residencies of oncologists do not teach you how to give bad news. So one thing you can do for yourself is look for that training and learn how to communicate and how to be very good in terms of communication with the patients and the patient families. Another thing is that because now there are some resources specific for advanced and metastatic breast cancer patients, you can direct the patient to those resources, and you can also work with specific organizations in your own country to translate those resources, because the vast majority is still in English, and there are not that many resources in other languages. And we know that that's very important for someone who is ill to be able to read or to listen in their own language and not a foreign language. So this is something that can also be done, is the translation of the existing resources into the needed language. And then there is the work of lobbying, either alone or inside the scientific organizations of your own country, and together with the patient organizations of your own country. There are a lot that can be done, both in terms of educating the general public, educating the media, but also educating and pressuring the politicians and the policymakers so that things can be changed in the years to come.